Hello and welcome. I wanted to take this moment to talk about understanding mental health. This May is Mental Health Month, and many a time we wait as professionals to talk more about mental health during this month when it's supposed to be actually an everyday talk. However, I've taken some time, to take a break in my work so that maybe I can take a few minutes to just make everyone understand what is mental health, because a lot of people still question what is mental health or mental illness per se. Many people with a mental health disorder, they don't get treatment. They don't still seek treatment, in this day. And yet it's important for us to understand that they may think it won't help, or they don't recognize that the symptoms that they are struggling with are otherwise treatable. They are treatable. Other people may not even be able to afford or access treatment, and that's understandable. However, there is treatment available when you walk into the hospital, or if you go to your medical professional to seek help, there will be some sort of help that they can give you. The social stigma is still around that still stops a lot of people from getting help. So, mental health or mental illness is actually a real disease. The diseases that people struggle with as in mental illnesses are just a disease, just like the heart disease or cancer or any other medical problem that we have. So, understanding that mental illness is not a weakness or a character flaw really will be helpful for many, and it's important that many people understand that there is nothing wrong with you if you're struggling with a mental illness or with mental health. Some of the most common mental health problems are depression, anxiety, panic attacks, PTSD, which is post traumatic stress disorder, bipolar disorder, attention deficit hyperactive disorder, which usually happens in young people, especially the teenagers. You have a lot of them coming up with the ADHD, if you heard the schools mentioning that, substance abuse, schizophrenia. So, mental health problems may be passed down from family illness, or they can occur because of an abnormal brain chemistry, substance abuse, or a response to a traumatic event or an abusive environment. Those things can also cause one to have a mental illness. In other words, a mental illness is not the fault of the person who's suffering. So, what are some of the symptoms that we may find one experiencing in mental illness? Learning these symptoms can help you recognize when you or a loved one need help. The symptoms include feeling sad, burned out, or just feeling useless, or just not feeling like yourself. Everyone feels down from time to time, and that's understandable. But if that emotion continues for more than 2 weeks, and you also have feelings of guilt and hopelessness, and maybe just crying and just feeling weak, it could mean that you're depressed. Severe and persistent symptoms are usually seen from people that say they have been sad, but the sadness is gone. By the time that they come for therapy, that sadness is gone for months and months and months. So at that time it's more severe. So when you are experiencing severe and persistent symptoms, of depression, of that, feeling down and just not feeling like yourself, crying. In other words, sometimes it even affects your sleep, then it's time to see someone and it's time to get treatment. Ongoing worries or fears, and I know people say, well, everybody worries. My mother used to worry, and I talk to people that worry all the time. No, people have unrealistic or extreme anxiety and worry about life circumstances, about bills, about things that they're going through medically, even in their own life. That's a mental health symptom at that point, because it's getting in the way of you doing the things that you need to do in life or feeling like you are okay. Sometimes some people will feel sudden, intense anxiety or panic attacks, which means they have these heart palpitations, chest pain, feeling like they are being smothered. Some people say they're feeling dizzy and they're just trembling or feeling like they're going to faint. Those could be signs of panic attack or a panic disorder. Some other unexplained physical symptoms can also occur, which means ongoing physical symptoms that, cause like emotional stress, or just physical symptoms that make you feel angry and just not in control of your own body or your own mind at that time. So you could have headaches, you could have stomach aches, and you could just have pain aches, body aches. You just hear people saying, you know what, I just have body aches. My whole body is aching, or my back. I have back aches, I have neck aches, or just my arms are just always, tingling and just feeling painful sometimes. So those are unexplained physical symptoms that can be caused by a mental health, ailment that someone might be going through. There's also chronic fatigue and lack of energy that people will report when they're having a mental health ailment as well. When your body cannot handle emotional overload, what it does is it shuts down. When you're having way too many thoughts, feelings, mental exhaustion, your body shuts down. Feeling too tired to do things that you used to love to do, or even feeling what we call emotional distress, which is depression. Staying away from other people. When you're spending all your time alone instead of with friends and family, that also could be a sign of stress overload, or also depression, anxiety, or even what we call a social phobia. When you're having intense mood changes or mood fluctuations, a sign of bipolar disorder could be what's going on at that time. And some of the symptoms that go with that, as well, are sadness, feeling low energy, feeling low motivation, loss of interest in the things that you used to be doing every day. And people will even say, there's something different about you. How come you're not even doing things like you used to? Pay attention to those things, because sometimes people will see that you're different before you can even feel or see yourself that you're different. During the high energy period, or what we call mania in a bipolar disorder, it's high risk behaviors that a person will do, such as gambling, overspending. They will be doing drug abuse sometimes, and are at high risk many a time of high sexual activity also at that time. Suicidal thoughts can happen when a person with bipolar disorder is at that high. The length of time between the cycles that a person with bipolar disorder will go through, they are actually very different, and they vary by each person. How you will get to know if all of these symptoms are leading to a mental health is for you to make a phone call and sit down and get what we call a thorough assessment, so that you can get the right diagnosis. So here I'm just sharing with you information that will help you pick up that call and normalize that. No, you know what, it's normal for me to call a mental health professional and actually talk to someone and get the right diagnosis, but most of all, so that you can get the right support. Other symptoms of mental health problems will be like things like ongoing nightmares, ongoing flashbacks. If something happened to you and you continuously have flashbacks of that event or that something happening, that could also be a sign of mental health symptom. Dramatic changes in your sleep or your weight. You gain a lot of weight, or you lose a lot of weight, or you start breaking out and your face is breaking out, your body is breaking out. Some people even drink more alcohol or even do drugs in order to numb the pain, the emotional pain. Those are some of the symptoms that will be necessary for you to pick up the phone and say, I need to talk to someone. I think there's something that is going on with me. People who have emotional disorders do not have to suffer alone. They can get help. So can you. It's very important to heal the mind with therapy and support services. So do not be afraid to ask for help. It's a sign of strength and not a weakness. I hope this information has been helpful in understanding general mental health. If you have work and you're working, there is a program called Employee Assistance Program, EAP. This program allows you to see a therapist or a mental health professional for free. Each company has a number of assigned sessions, and to this day they probably will start from around 3 sessions to 20, 30 sessions that you literally can get for free. Your company does not know and do not even, they don't even know who has called that number, and they have contracted with outside providers that will be able to see you and talk to you. So do not be afraid to tap into that. So Employee Assistance Program works like this. You call the 800 number or ask your job for the Employee Assistance Program, EAP. You call that number 24/7, 365 days. They give you those sessions. Let me give you an example of 8 sessions. Let's say your company gives 8 sessions. It's 8 sessions per situation that is going on with you in your life. That means if you call because you're stressed out at work, you get 8 sessions. If you call because parenting, you're stressed out as a parent, so you need parenting, advice or to talk about parenting, 8 sessions. You now have problems with your spouse. Communication is a problem and you guys are on different pages. You get another 8 sessions for, having the problem in your relationship, in your marriage, in your dating. And then you say, well, at the same time, I also want my spouse to be seen so that they can, also know how to communicate with me. You get your 8 for your individual session. Your partner gets 8 sessions. And then together, you also can get 8 or 16 sessions. Some programs will give you 16 sessions for couples session, all at the same time. So you can see your own counselor on Monday, your wife or husband sees their own counselor on Wednesday, and then on Friday, the two of you see a different counselor for couples counseling. And then you say, well, wait a minute, we also have children. This one is not doing well in school, and that one, has a hard time focusing in class. That's what they told us. You get 8 sessions for each one of your children. You get 8 sessions. And then you say, well, but how do we support our kids so that we can help them? You get another 8 sessions for you to be able to meet as a family so that you can talk about how to help your family. So that's how EAP works. And many people continue to struggle when there's this great benefit that is in the workplace that you can use and utilize throughout the year and every time that you're struggling either at work or at home. So please do make a time, some time to access that great benefit that you all have at work. So you can use the husband's benefits from his EAP, and you also can use the wife's benefits from EAP. It's never ending, but there's no reason for you to struggle without talking to someone and getting support, because there is a free support that is available to you. My name once again is Dr. Stem. If you want to know more about the support that I provide, you may go to my website, www.drstemmie.com. Thank Thank you for supporting my YouTube channel. I ask if you have not subscribed to please subscribe. That will support me, and also share these videos with other people. Until then, be encouraged.